Good afternoon. Today I'll continue to be talking about the coronavirus and the latest updated news. So today I'm sure you've all heard that the United States has, the amount of cases has passed 100,000 people. Yes, 100,000 people are now cases are in the US, and I just want to point this out because this is quite a benchmark. Which is a benchmark, and the national death toll has surpassed 1,500. So I know that everybody's saying that United States is the leading number of cases with the known coronavirus cases, but I wouldn't say that for sure because obviously China's data is obviously lying. It's completely false and untrue. So don't ever believe anything that comes out of China. But if US has already gotten it this bad, the capacity is already this much worse than it was before, then I'm sure China's probably suffered worse than what the US is suffering because, well, that's where the virus was originated in. So I'm pretty sure China's cases are probably still more than the US, even though like their official numbers are lower than 100,000, but I'm pretty sure that they probably are higher than 100,000. That's like for sure. The second thing I'd like to talk about also is that US cities are overwhelmingly facing shortages of masks, ventilators, and emergency equipment. So the United States Conference of Mayors questioned officials in 213 municipalities and found serious shortages that underscored the scope and severity of the crisis. Basically, more than 90% of cities said that they did not have an adequate supply of face masks for police officers, firefighters, and emergency workers. 92% of cities also reported a shortage of test kits, and 85% did not have a sufficient supply of ventilators available to the local health facilities. Roughly 2/3 of the cities said they had not received any emergency equipment or supplies from the state, and 85% that did receive state aid said it was not enough to meet their needs. Basically, in total, the conference tabulated that cities need 28.5 million face masks, 24.4 million other items of personal protection equipment, and 7.9 million test kits, and 139,000 ventilators. So these are just some data for you to look at, and so this already shows the severity of the situation and how much the health workers are needing their supplies, because maybe one supply could save a life and one shortage of a supply could possibly just kill a life. And so the second thing I'd like to talk about is, quite interestingly, I think there was something that, while this disease is the coronavirus affects some patients in unexpected ways. So usually it mostly affects lungs, causing pneumonia in severe cases, and the typical symptoms are fever, cough, difficulty breathing, fatigue. But a patient recently in Brooklyn have arrived at the hospital with symptoms not of a respiratory disease, but of heart attack. So when you look at it closely, the Brooklyn patient, some others were suffering from acute myocarditis, a severe inflammation of the heart. This condition was also seen in patients with other viral infections, such as the H1N1 swine flu and the MERS, but this is saying that patients with heart complications have a risk of death nearly 4 times higher than patients without heart complications. Newborns and babies are so far largely to be unaffected, but three small new studies suggest that the virus may also reach the fetus. And these are just really interesting that the virus can affect each unique individual in unique ways. And so that's it. Thank you for listening, and I hope you have a good day.